Bob, how are you?
Bob. Hi, I'd like to point out to the audience that the change in eligibility for Medicare from 65 to 67 is different in character than the raise in the retirement age from 65 to 67 that occurred in 1982. The Social Security retirement benefit is available at age 62, and if your normal retirement age is 65, you get a 20% cut in your benefits, but you get your benefits at 62. You're eligible. When they raise the retirement age from 65 to 67, people our age, if we decide to take retirement at 62, our benefit is not 80%, but 70% of the benefit we normally would get.
Right.
The change you're talking about in terms of Medicare would make you ineligible for the 2 years.
That's right. You'd have to go on to depending on, you'd have to go on, well, I mean, look, even assuming that Obamacare actually functions the way that it's supposed to, and assuming that every state is going to expand its Medicaid, which it's not.
The idea is that it's rhetoric.
Right.
When you hear reporters talk about, it's the same thing as having a longer life expectancy, so we're adjusting the program to reflect that. Well, the change in 1982 didn't do that. You always had the early retirement benefit at 62. They just cut the benefits.
And I would add that since Medicare has been instituted, life expectancy has grown by about 4-something years for people in the upper half of the income distribution, less than a year for people in the lower half. And I would also argue that on top of that, part of the reason why that life expectancy has probably grown is because of Medicare. That's what doesn't get factored into it. People talk about life expectancy has increased, so we should raise the eligibility age for Medicare. Well, part of the reason why it's increased is because people are getting health care at that age when they couldn't afford it in the past.
Part of the problem is the reporters don't know that everyone gets almost 90% of the people who retired in Social Security don't decide to wait until normal retirement age. Almost everyone takes it at age 62. And nobody who doesn't work in retirement, I worked in retirement for almost 2 decades. I know all this. I know how you calculate what the benefit is. And when they talk about changing the CPI, it's like another cut, just like the raising the retirement age.
Yep.
It goes all the way across the board, which means that it affects poor people as much as it affects richer people, which is the exact wrong type of cut. We need to cut how much we spend, but we don't want to cut it across the board. So the equivalent of the Medicare eligibility age would be to charge people a higher rate at the earlier ages, which was what lame duck Connecticut Senator Lieberman suggested when he said, let's make Medicare eligible at age 50, but we pay the full freight.
Right. Yes.
It drops.
He issued that. All right, Bob, your phone's breaking up, but you're right. Lieberman did propose that back before, at a time where, now this is the trick with Lieberman. Supposedly he decided not to have a Medicare buy-in for people. I think it was 55 they were talking about, but maybe it was 50. But he was at one point in favor of a Medicare buy-in where you basically pay a higher premium, but it's better than the private insurance. But when I think it became clear to him, and some people attribute it to just liberals wanted it, so he decided to go against it in the Affordable Care Act debate. I think it was more that once it was clear that the mandate was there and that the insurance business, essentially, the health insurance business was going to survive because it was an unsustainable business, basically an unsustainable business plan. Once it was going to survive because of a mandate, you no longer needed to save the health insurance industry by getting all those people who are over the age of 50 or 55 out of the risk pool and move them into Medicare. And so that's, I believe, why he changed his mind. But I appreciate the call, Bob.